Dehydration. When the body loses more fluid than it consumes, especially water, dehydration occurs. The human body loses water through evaporation in breathing, sweat, urine, and feces during everyday physical activity. When the body loses water, it also loses a little quantity of salt in comparison to the amount absorbed, resulting in a negative balance that leads to dehydration, particularly severe dehydration that can lead to death. Adults and children can get dehydrated in two ways. Excessive water loss. Intake of fluids has decreased. Dehydration signs and symptoms. Dehydration symptoms can range from mild to severe. 1. Dehydration's early signs and symptoms. The following are the main signs and symptoms of dehydration. Thirst for water. You have a dry mouth. Weakness in general. Palpitations and dizziness, palpitation. 2. Severe dehydration symptoms. If the body does not adjust for the lost fluids and fills the void, dehydration can increase, resulting in the following symptoms. Perplexity. Suffering from a loss of consciousness. Convulsions are a type of seizure. Convulsions are a type of seizure. Urine that is dark in color. Dehydration causes and risk factors. Dehydration can be caused by a variety of circumstances. Dehydration can be caused by a variety of factors. Dehydration can arise in the following circumstances. Increased sweating as a result of elevated body temperature in situations of disorders accompanied by fever or when exposed to high temperatures. Excessive physical activity, especially in high temperature, high humidity environments, accelerates the process of water loss from the body. Vomiting on a regular basis. Constant diarrhea. Urinating frequently, which could be a sign of a urinary tract infection, or taking heavy doses of diuretics in patients with diabetes or other conditions like diabetes insipidus. Burns to the skin that are very deep. At-risk categories. The following are the most vulnerable groups. Children, the elderly, or the crippled who are unable to provide for themselves and require assistance from others on a regular basis. Patients who rely on artificial respiration to breathe. Patients who are in a coma, and are administered external water. Fasting under some situations. Dehydration complications. Dehydration that is not treated can lead to the following complications. Issues with the urinary tract and kidneys. Epilepsy is a condition that affects people. Hypovolemic shock is a condition in which there is a lack of blood in the body. Dehydration is diagnosed. Dehydration can be diagnosed with a urine and blood test. 1. Examination of the urine. The urine will be black in color if you are dehydrated, and the results of its analysis will reveal the following. There is a high concentration of glucose in the urine, which could indicate diabetes. An increase in protein concentration could mean you have kidney disease. Inflammation can be detected in a urine test as a cause of dehydration. 2. Take a blood test. Blood tests may reveal elevated levels of sodium, hypernatremia, urea, and creatinine, all of which reflect the severity of dehydration. The existence of inflammation as a possible cause of dehydration is shown by a blood type test, since the significant number of white blood cells suggests the presence of inflammation as a possible cause of dehydration. Treatment for dehydration. The severity of a dehydrated patient's condition determines the course of treatment. 1. Treatment at home. In cases of simple dehydration, home treatment is a main treatment in which an attempt is made to slowly and gradually return a quantity of fluid to the body, and it is as follows. Drink sweetened drinks to help your body reclaim some of the salts it has lost due to the fluids. Drink water slowly yet steadily to ensure that a substantial volume of fluid is returned to the body. Avoid replacing lost fluids quickly if you are dehydrated, since this might aggravate symptoms by causing a salt imbalance in your blood. Attempting to lower the high temperature by taking medications, removing excess clothing, and avoiding being in extremely hot environments. If the patient has suspected heatstroke, put him in a cool environment, near a fan, or cover him with damp towels or a damp cloth. 2. Hospitalization. Returning fluids to a dehydrated patient in the hospital is accomplished by an intravenous infusion is a type of infusion that is administered through the veins. Attempting to detect and treat the direct cause of dehydration, such as utilizing antibiotics to fight bacteria and insulin to treat diabetics, as well as correcting salt imbalances in the body. Dehydration prevention. Overall, despite the dangers of dehydration, following certain preventive measures, the most essential of which are: to avoid dehydration, people are becoming more aware of the need and necessity of consuming substantial amounts of fluids. When exercising or expending tremendous physical effort, it is important to drink plenty of water, especially in hot and humid weather. Ensuring that children, the elderly, and the disabled consume enough water, taking into consideration their health and the surrounding environment.